So I was just thinking about how podcasting really changed my ability to level up. There were so many things that I was thinking about in my practice that would come up with clients, and or just how I was running the practice. And the podcast really allowed me to explore this on just like a much deeper level. And so one thing I did is I put together this podcast, but then also took some time to think about that process of starting a podcast. And I've put a ton over at podcastlaunchschool.com as a way to just help therapists that want to start a podcast. We have a bunch of services over there if you're looking to go full tilt. But honestly, just starting a podcast, learning about it, we have tons over at podcastlaunchschool.com, and we'd love for you to check it out. This is the Practice of the Practice podcast with Joe Sanok, session number 1397. I'm Joe Sanok, your host, and welcome to the Practice of the Practice podcast, where we help you build a thriving private practice you absolutely love. We want you to thrive. We want you to know all the things that have to do with business and being a CEO and having that mindset. And we want you to love your practice. We want to feel like the things that we're doing in the world, the way we're using our time as a human, is something we want to do, that we're not just stuck in what we think we're supposed to do for whatever reasons, but we want to actually evaluate, do I want to keep seeing these kind of clients? Do I want to add team members? Do I want to grow into something bigger? Do I want to partner with different organizations? We want to do all of that, which is why I'm so excited to talk about federally qualified health centers today. This is a topic we haven't really dug into much on the show, which is great because we have Jill Steeley with us, who is an MPH, also a federally qualified health clinic a consultant, executive coach, and host of the Community Health Collective podcast, dedicated to helping federally qualified health centers become profitable, reputable, and sustainable through sound business principles and leadership excellence. She spent more than 9 years as the CEO of Pureview Health Center in Montana, where she turned a nearly $1 million deficit into multi-millions in revenue, grew annual revenue tenfold, and doubled the organization's unique patient base. After leaving that role, Jill launched her own consulting and coaching practice, offering leadership development programs, group and one-on-one executive coaching, and a CEO boot camp designed specifically for health center executives navigating the unique challenges of that model. She holds master's in public health, a bachelor's in business management, and is a certified balanced scorecard facilitator and certified KPI trainer. Jill, welcome to the Practice podcast.
Thank you, Joe. I'm so glad to be here with you today.
Yeah. Talk about powerhouse. You got some background in business and management and CEO work. So I'm so excited to have you here today.
Oh, thank you. I'm really excited to be here.
Yeah, well, I live in Michigan, and we visited Montana a few years ago, and boy, what a state that I should have been visiting more than just once. What a beautiful state to be in.
It really is. I mean, I've been here about 21 years. I'm from Salt Lake City, Utah, so I've enjoyed in my life the beautiful places like Utah and Montana. So, yeah.
Yeah, my uncle lives in Salt Lake City. I was born in Logan, Utah,
Oh,
actually, as my dad was doing his PhD at Utah State. So,
another Utah.
yeah, I left before my memories started, though. So
Right.
I think I was 6 months old when they moved back to Michigan. So, but I have that special connection with Utah.
Yeah.
Well, so let's talk about first, for those that maybe heard about them in grad school and maybe have heard about them in their community, let's just make sure we have definitions down before we
Yeah.
go too far. So federally qualified health centers, let's talk about what those are, maybe the unique challenges of those compared to just a kind of typical private practice. What is a federally qualified health center, and maybe how is that a little more unique than just a typical counseling practice?
Yeah, great question. So, a federally qualified health center is another term for a community health center. There are 1,500 of them across the country. They and also in other U.S. territories. They are privately owned nonprofits for the most part. There are some that are owned by their local government. My health center was a county department. When I started there, I separated us off and became a private nonprofit, which is how most of them are. Some are public entity health centers. But the unique model of a community health center is that they do receive some federal funding in order to provide comprehensive primary care to those who otherwise wouldn't have access to health care. So think about low income, underinsured, uninsured, or even geographically unable to access health care. So they do receive some federal funding, which means they are highly regulated by the federal government, and they are required to provide medical, dental, behavioral health, and some of them also provide pharmacy and specialty care as well. So it's a
You know,
complex business model.
yeah, yeah. Now you mentioned kind of spinning off of being underneath the county government. What's the benefit of being a nonprofit separate from county government, and like what do you lose by doing that?
Well, that's a great question. So, when my health center was formed in 1994, they were really just planning on serving those who did not have a payer, so did not have insurance. And they applied for the federal grant to be a community health center under that umbrella of the county, thinking that they needed the county's business infrastructure in order to make it work, since they would not be
Mm.
billing insurance and having a payer for the patients that they were serving. That was fine and worked fine for the first probably 15 years. But as they grew and became a health center that served everyone and billed, all insurances, that really didn't work anymore. It's funny because county government doesn't quite move at the speed of healthcare. So,
That is true.
yeah.
I was wondering if that was going to be part of your answer. Is like just,
Yeah.
you need oversight, but also the layers of approval and bureaucracy
Oh,
has to also be just tough.
yeah. I just don't have the patience for it.
Well, and so often it changes based on political winds, where
Absolutely.
it's like, the county commission here, we had a guy who he brought like a gun to a virtual thing, and he was one of the county commissioners, and
Yep.
it's just like those are the people leading us. Like, yeah, I couldn't
Yep.
imagine if your like nonprofit board turned over without you having any sort of influence over it.
I mean, we had a county commissioner that was anti-masks in during COVID, right? So, and we
Yeah.
were requiring everyone in our health center to wear a mask, including our staff, and it just doesn't work. It's not a
Yeah.
it works for some. We used their IT department, we used their HR department, we used their accounting department. Some of those were fine, some not so great. So I
Yeah.
separated us off. We separated on March 1st of 2020, and then we all know
Great
what
time to
happened.
start something new.
Yeah. Thankfully, we did, because the county did not want anyone using Zoom for about 3 months after the
Mm.
pandemic started, and so we jumped in right away and started offering telehealth on Zoom within about a week after everything shut down. So it was good timing on our part. But yeah, it was a very interesting way of doing business. I appreciate that partnership with the county. We ended up being the preferred primary care provider for county employees and their spouses and dependents. So it was a good partnership. And we were able to serve them as well as grow our patient population through them. So that was good. And but other than that, it was nice to separate off and have our own IT, which could keep up
Yeah.
with healthcare.
Now, what have you noticed in regards to trends from, having been a part of so many of these? Thinking about when Obamacare rolled out the Affordable Care Act, and then the Trump administration, then the Biden administration, and the new Trump administration, like what has shifted back and forth regarding kind of federal funding and just what the real life experience is of these federally qualified health centers?
Yeah, it's been rough the last probably 10 years. So I started there in 2015. I left in the later part of 23. And I would say that, just during my time there, we used to see bipartisan support just across the board in Congress and allocating those federal dollars to community health centers to provide that safety net care. And that really stopped, the bipartisan part stopped, probably in 2015, 2016. And we haven't really been able to get that back. Now, there definitely are supporters on both sides of the aisle of federal funding going to community health centers. It's just more scrutinized. There's always this waiting period of, are they going to approve it this time? And then the shutdowns that happen, that can affect, the health centers getting their grant payments, things like that. So it is a little bit, it's very nerve-wracking, the uncertainty that they face and deal with. And that's really why I started my CEO bootcamp. I do that with another consultant, Steve Weinman, and we really teach them how to be profitable and sustainable without grant funding and without federal funds. Similar to a private practice, like you have to be able to make it work. You got to increase your revenue.
I want to get to some of those principles for sure and talk about that boot camp and also talk about just like what we can apply to private practice. For folks that are listening to this, as we're talking about kind of bipartisan support, all that, we had retired U.S. Senator Debbie Stabenow here on the show back in episode 1280. That was just about a year ago. And I still remember her talking all about just working across the aisle to just increase mental health access through these federally funded clinics. So if you're looking for kind of another standalone episode, 1280 is a great one to go back to. Debbie was just amazing on the show. So just wanted to make sure I noted that. So when we see you start to leave, start to the consulting, all of that, now you're working with people at the executive level. What are you seeing in regards to maybe the biggest challenges with the executives that you work with right now?
Yeah, that's a great question. Honestly, I think that a lot of them are clinicians who have been promoted into an executive role, and they will tell you this. They were not trained in business skills and the skills that it
sounds familiar.
The skills that you need to have to, increase profit, to be profitable. And we're so afraid in community health, especially because they are nonprofits, to say the word profit, right? We're afraid to even talk about profitable. But in reality, if the doors are closed, we're not serving anyone. So we have to be profitable. We have to be sustainable. And those same principles apply across the board, whether you are running private practice or community health or a hospital setting, whatever it is. And so a lot of my clients are clinicians who've worked their way into those executive level positions. And now they're kind of like, wow, I don't know how to run a business. I'm just going to keep doing what my predecessor was doing, even though things have changed so much in the last even just 6 years. And that's like working from, your atlas instead of your phone's map, right? It's like we're still working from these really old maps and hoping that it all works out, and it just isn't working anymore. So that's one of the biggest challenges that I see with my clientele. Another one would just be that a lot of them come from other kinds of nonprofits, and honestly, they are in the mindset of, we just have to raise money. We have to do fundraising. We have to find grants. And like I was saying earlier, that's just not sustainable. That's not healthcare. Healthcare should be profitable. Do we need to control costs? Absolutely. And I teach how to do that as well. But it can be profitable, and it should be profitable so that we can keep the doors open and keep seeing the people who need us there.
Yeah. Something I hear over and over from practice owners in the Practice Academy is the one class I never was taught in grad school was how to run my business. And honestly, I felt that same thing. It's not a personal failing, but it's a gap in how we train clinicians. You build something that's real, your private practice, and nobody handed you a playbook for intake, billing, team management, or what it actually takes to scale past a handful of clinicians. That's what Valent is built for. Valent is the EHR designed exclusively for behavioral health group practices. With 2 decades of experience, 13 million clients engaging in their EMR, and 28,000 providers using their platform, Valent offers the tools that close the gap in your documentation, billing, and operations. Also, they include AI that handles the admin work so that your team will stay focused on your clients. Valent created a free interactive resource specifically for group practice owners like you. It's called Breaking Through the Growth Ceiling. It's called Breaking Through the Growth Ceiling. In literally 5 minutes, it pinpoints your biggest bottleneck right now with a 90-day playbook to fix it. It is awesome. So if you want to break through the ceiling of growth that you feel like you just haven't been able to break through, grab that for free over at valent.io/Joe. That's valent.io/Joe. Valent is spelled VALANT.io/Joe. So what are ways that these programs are moving towards more profit and less reliance on grants and fundraising?
Yeah. So, the things that I teach is to increase and diversify revenue. So, how do we attract more insured patients with a payer? How do we serve them the way that, how do we serve everyone in a better way with more transformational healthcare, not transactional healthcare? That's really what consumers and patients are looking for now.
Tell me what that means,
Yeah,
transformational instead of transactional.
sure. So, in the past, it's been, hey, you show up for your appointment. Maybe we sent you a reminder. Maybe we didn't. You showed up for your appointment. You filled out your paperwork, talked to your provider, left with some instructions from your provider, but then you're just really not hearing from them again until you need to be seen again. These days, patients and consumers not only want transformational healthcare experiences, which mostly means that every touch point that a patient or a potential patient has with your clinic should be kind of like rolling out the red carpet. You should be anticipating their needs. You should have front desk people who are trained in hospitality, who are even trained in some trauma-informed care, because so many people there's a big trust deficit right now in healthcare. So they're showing up already nervous about being there, already not sure that they should be there or that they need your services. And so how can we, from the minute they contact you to schedule an appointment, look on your website, whatever it might be, how can we start that wraparound care, just talking to them, communicating with them in ways that they want to be communicated with, and that really depends on their age. It depends on their income level. It depends on their tech savviness. And we don't just want to stop communicating with them once they leave that appointment. We want to keep that communication going. We should be celebrating some milestones with them. We should be remembering important dates to them. And just how can we keep that communication line open outside of that appointment? Because that's really what is going to keep bringing them back to that practice over and over again. They don't want to keep looking for healthcare. They don't want to keep looking for a different counselor or therapist. If they like the person, they want to stay there, but they want to hear from you in meaningful ways. They want to know that they're not just a number in your practice, that they are, someone that you actually care about and appreciate coming to the practice. So that's transformational healthcare instead of transactional healthcare. We have so much technology now. It's really easy to just kind of, let the technology take over, but people are still really craving that personal experience and for us to be personable. There are definitely appropriate ways to use AI and our technology, and we should be using those, but we also need to have that personal touch as well. And then I also teach reducing costs and making things more efficient, optimizing staffing levels so that we're not overstaffed or understaffed, which can be very expensive. We're not losing employees and having a lot of turnover costs. We also teach them marketing, outreach, because so many of us just think that people know about us and they don't,
Yeah.
or they're confused. What exactly do you do? Do you take my insurance? Do you see someone of my age? Do you see someone with my needs? So we have to be better about marketing and telling them who we are, what we do, who we serve, how to make an appointment, all the things. And then, just how do we keep this going? How do we be sustainable year after year?
How do how does an owner or CEO really have eyes on the user experience? Because I think that when you're a CEO or you own your counseling practice and it starts to grow, you're not in there in the sessions. You're not maybe even seeing the little frustrations people have. Where it's, like even just today, I go to a great PT place. They sent me an automated text, hey, you have a bill from the amount that you owe. I get in there, so it's on my phone, and they don't take Apple Pay, and it's like I have to then go find my credit card, and I'm like, I'm gonna just wait a couple days
Yeah.
till I have time to pay this. Whereas if they had Apple Pay with a double click, like seriously, they would have been paid like a week ago.
Yeah.
So like the average owner isn't like going through that process, and that's a frustration point for end users that like just might go unseen. So like what can owners do to just have eyes on some of that user experience?
Yeah, that is a great question, and something that I always did and thought about. First of all, for me, I was always a patient and still am of my health center. So,
Mm,
although that can be a little maybe intimidating for the providers, I'm not sure. They never said that. But I did so because I believed in our providers. I thought they were amazing clinicians, but also I wanted to experience it from a patient's perspective. And what we teach in our boot camp is to map that patient's journey. So
mm,
we give them several different personas. So it could be a patient with, bipolar disease 1, or a patient with multiple chronic diseases and a mental health disorder. It could be a patient with a substance use disorder and diabetes, right? And so we give them different personas, we assign those to staff, and then we have the staff as that patient go through the entire journey. So
mm.
scheduling the appointment, what is that like? What is it like to come in? What is it like to park? Was I notified of where to park, what door to come in? All the way down to what is it like after the appointment? To your point, I can't stand the same thing. It's like if you just sent me this in a way that was convenient for me, I would have paid that bill immediately. I would have,
Yeah.
or the reminders that don't let you reschedule or cancel. It's like, this is why we have no shows, because this person scheduled this when they were in crisis. Now they're not in crisis anymore. And you sent them a reminder text, but to have them be the person that has to call in and change that appointment, like it's not happening. And so that's why they're no showing, right? So it's just going through that journey of a patient is really important. And then, of course, asking them, even if you just did a net promoter score, text at the end of the appointment would tell you a lot about that person's experience. If they're not willing to just give you a simple rating on whether or not they would recommend you to a friend or family, there was something wrong there. It's even
Yeah.
better if you can ask them very specific questions and have them say, like, yeah, I was given all the information I needed during my appointment. My provider made eye contact with me. My provider was helpful. So, asking is a great way. Most people won't fill out a survey, but a lot will.
Yeah. I'm taking some notes for Great Lakes Online Counseling. So I've been building this counseling practice on the side. So I had one that I sold in 2019, and then I've been since probably February spending 2 hours a week building this publicly, and then doing a podcast on it. And so even just like Net Promoter Score, or like I'm adding this into the Trello board for Great Lakes Online Counseling for me and Jen to talk through, just to make sure that like we've got those systems set up in there.
Yeah.
So I'm wondering, how can imagine a local therapist, either they're a solo practice or group practice. They believe in the mission of these clinics. They want to promote them. They want to partner with them. They want to collaborate. What can local therapists in private practice do that can both help their business, but also help the health clinics?
Yes, I love this question. There are a lot of things they can do. So what I always did was I would visit private practices, whether it was pediatrician clinics, whether it was dental clinics or therapy clinics, to tell them all the services that we provided. Because if you have a patient, a mental health patient, who is not managing their physical health, you're not going to get very far with that person. They might be showing up to the appointments, but to really see progress, we have to address the physical health, and even the dental health counts in that. Dental is one of the number one reasons people go to the emergency room. So, we always say in community health that if we don't address those social determinants of health, a person can't get better. So that's their physical health, their mental health, their housing needs, their food insecurities, their job, their family, their daycare. All of those things can be very distracting to a person getting better and being healthier. So your community health center can help with all of those things. They should be providing dental, primary care, really discounted pharmacy. So that's another great partnership with a community health center. Most of them are part of a federal program that allows them to buy and sell drugs at a very discounted rate to their patients. So if you have a patient that's on a psychotropic medication and it's very expensive and cost prohibitive, have them establish care with the community health center. They sometimes will have psychiatric nurse practitioners or psychiatrists, or even primary care providers or clinical pharmacists who are trained in those kind of medications, and they can get them at a way discounted rate. I mean, I use the example of insulin, but insulin, it used to be, it's a little better now. It used to be like $400 a month. And
I'm type 1 diabetic, and it was $600 a month.
Right.
Then I ended up getting it from Canada, and it was like $200 a month. And now finally it's like $30 to $50 a month.
Right. And we've always been able to get it for you for $30 a month. So that's just an example. A lot of them do infusions. A lot of them do specialty drugs. So call your community health center. If you want to call me, I can help you with that connection. But call your community health center, ask them what services they do provide for their patients and how the referrals work. So how do you refer a patient to the community health center, and how does the community health center refer patients to you?
So good. The last question I always ask is, if every private practitioner in the world were listening right now, what would you want them to know?
Oh, you have a hard job. I feel for you. Hang in there. What I want you to know is that sometimes we get stuck in our own way. We get in our own way. And we really have to think about what is bogging us down. Go through your schedule, go through your day, go through your time commitments, because my guess is you're doing a lot of things manually, or things that you as the practice owner don't need to be doing. You just haven't learned good time management or delegation. And that can really help with your own mental health, your own self-care. If you can get some of those tasks of being the practice owner, those day-to-day operational tasks off your plate, and either automated, get rid of them, have AI take care of them, have an assistant do them, so that you can be the high-level strategic thinker. You're going to be a lot happier, and your practice is going to run a lot better and be a lot more sustainable. So that's my 2 cents.
So great. Jill, if people want to do your CEO boot camp, who would be an ideal person to join, and how can they read more about it?
Yeah, so we would love to have you. We're starting our next cohort in early October, and you can find more information on my website, jillsteeley.com. You can email me. I'd be happy to schedule a call with you. It really is for executives, leaders of health centers, private practice, rural health clinics, tribal health. We have all kinds, and we have people from all over the country. So it's great to hear everyone's different perspectives, different challenges. And it's a 5-month program. We teach you the strategies like increasing revenue, being more profitable, reducing costs, but we also give you a lot of coaching time with us as the consultants. So check that out on my website, and we'd love to have you join our next cohort.
Awesome. And we'll have links to that in the show notes as well over at practiceofthepractice.com. Jill, thanks for being on the show today.
Thank you so much for having me. This has been great.
It's just, I have to give a shout out to the Traverse Health Clinic here in Traverse City that is doing health care that is a federally qualified health center. And Rick and Mary Ellen Sanok, my parents, my mom's a nurse practitioner. She helped start the medical wing of that. My dad's a psychologist, and he started the behavioral health wing. So they worked with so many just amazing people in our community to get that started, and then to eventually have it be federally qualified. It's just great to be having these kind of conversations, knowing the hard work that my parents did to help our community. And they've since retired from that work, but that program continues. So thanks, Mom and Dad, for all that you did with helping Northern Michigan get a federally qualified health center here. Also, we couldn't do this show without our sponsors, which I'll tell you about in just a second. But also, we have our new basics course. It's called The Basics of Private Practice over at practiceofthepractice.com/basics. There's 2 different journeys. They're both free. One is about solo practice and one is about group. We've got some trainings in there, live video downloads. We have a whole AI training in there as well. So if you want that for free, that's just over at practiceofthepractice.com/basics, and that's going to help you really get the basics of your private practice down. Hey, special thanks to Valent today for sponsoring this show. They put together an amazing resource. It's going to take you 5 minutes to quickly evaluate what's stopping your growth. It's going to pinpoint your biggest bottlenecks right now and give you a 90-day playbook to fix it. You can download that totally free over at valent.io/Joe. That's VALANT.io/Joe to grab that resource. Thank you for letting me into your ears and into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.